Anxiety disorders are very common in both substance abuse and eating disorders. Generally, the kinds of conditions I see working with these populations include generalized anxiety, which is a feeling for a patient when he or she wakes up that they feel on edge from the moment they get up in the day, and throughout the whole day they feel like there's some impending doom going on, and they can never relax, they can never get comfortable. So some substance abuse patients will drink alcohol. I mean, it is an anxiolytic, or it does decrease anxiety, but it's not really the treatment that's needed. They need special types of therapy, exposure therapies, to work on that. Another common anxiety disorder would be post-traumatic stress. I have treated countless patients who have been sexually abused, which is very common in women, unfortunately. Almost 20–25% of my patients have been sexually abused. I have treated men that have been victims of just firefighters, have seen horrific death and trauma, police officers, people have been shot at, people that have been in war over in the Mideast, and it's just not what most of us are used to. I don't even know how you can prepare for something like that. And so they come back or come into treatment having nightmares of the events, flashbacks of the events, avoidance of the events. And if you're a police officer or firefighter, you can't, avoiding the events mean you don't go to work. And so all of these are problems. A final condition I see a lot of is obsessive compulsive disorder. Now, simply put, it's where someone has an obsession, a thought that they can't get rid of unless they do a behavior. So a common one is germ phobia. There's a lot of germs around, and when the swine flu virus was out there, and the bird flu virus, the avian flu virus, it really gets people in an uproar. But if they have OCD, obsessive compulsive disorder, they will go into amazing hand-washing rituals, wear special masks to avoid contamination. They won't touch doorknobs. At the Recovery Village, we address anxiety disorders of all levels. If someone's using substances or has an eating disorder, clearly we'll address that primarily head-on. We try to deal with the other events with different types of therapies. The most common is exposure response prevention therapy. So for an eating disorder patient who's phobic of food, we'll have her eat, and which we have her eat anyhow, he or she. 3 meals a day is exposure therapy session. 3 snacks a day is an exposure therapy session. And the more you're exposed to your fear, it just becomes an event versus a fear. And so that's a great intervention we use. There's other types of behavior therapies we use as well for post-traumatic stress, as well as for generalized anxiety and social phobia. But all of them pretty much involve some sort of exposure therapy.